So we all wait for monsoon to give us relief from the summer, but at the same time, monsoon heralds the onset of a lot of infectious diseases, and one of the main ones that we're here to talk about today is dengue. Now, dengue is an infectious disease that worries parents a lot, and they have a lot of questions, and we're hoping to answer most of your questions in this session. I'm Dr. Suruchi. I'm a pediatrician here at Manipal Hospital Varthur, and with me today is Dr. Gurudutt. He's our pediatric intensivist here at Manipal Hospital Varthur. So Dr. Guru, tell us, what is dengue exactly?
So, in simple terms, Dr. Suruchi, it is a viral infection and it is caused by a mosquito bite. And the specific name is Aedes mosquito. It's a female mosquito. And directly by the mosquito bite is how one can get dengue.
So, can it transmit from one person to another then directly?
Yeah, that's an interesting question because we get asked a lot of the times. But there is no direct spread from one human to another human because it can only be caused by a mosquito bite. So if we can avoid the mosquito bite, we actually can avoid getting dengue. Although a infected mosquito can bite two individuals and they can have the dengue, so it doesn't spread from one person to another.
Yeah, so that's a very worrying question they ask us. They're always worried, father has dengue, will the child get it? Yes. So yes, it cannot transmit directly, but there has to be mosquitoes biting both of them to cause it,
Yeah, because the dengue virus can live either in a human being or in a mosquito, and there is nothing else in between. So, moving on a little bit further, with your experience as a pediatrician and your OPD consultation, do you think all the children with dengue require admission, or can they be managed in OPD?
So we see a lot of dengue at this time of the year, and a lot of children with fever do test positive for the dengue NS1 antigen. Now, dengue itself is generally managed at home. About 95% of our children are managed by monitoring at home. So we see them regularly in outpatient, we manage their fever, we give them advice on hydration, we repeatedly do their blood tests in case there is something out of place and we need to act on it. So 95% of children go through all the three phases of dengue, the fever phase, the leaky phase, and then they recover very well at home, and we monitor them repeatedly. But about 5% do show some warning signs, and that gives us an indication that these children require a little bit more than home management of dengue, and these are the children whom we then admit and manage on the ward.
Yeah, so the high-grade fever in the first 2 to 3 days seems to be the worrying symptom from parents' point of view. Because they have such high-grade fevers up to 103, 104, you must be having a lot of difficulties explaining to the parents the degree of fever, as well as explaining to them, giving plenty of fluids to prevent them getting dehydrated. So you were just talking about warning symptoms. Can you just elaborate to the benefit of our patients, what do you mean by warning symptoms or signs?
So the things that I look out for children in OPD are, one is an unremitting fever at all. You've done everything to manage the fever and they're sitting at a high grade fever of 103, 104, chills, rigors, because that can precipitate dehydration. So fever itself is not the worrying feature, but it is the consequences of the high grade fever. The second thing is tummy pain, which is then associated with vomiting, which then leads to dehydration again. So we do admit these children. We have children who refuse to drink altogether, especially the younger ones. When they are sick, they have loss of appetite. They also don't take liquid. So we do admit them as well. We have children who may be very drowsy, may be lethargic. Now that could be a consequence of the dehydration, or their blood pressure may have dropped because of the dengue. So we do admit them too. So we have, these would be my clinical assessment for admitting the children. So there's this other group of children who have gone through the fever phase and now are what we call in the leaky phase. And they can have sudden drop in platelets, or their platelets may have reached a level which generally is around 80,000 to a lakh when we say that they should come into the hospital for much more closer monitoring of their platelet count. So overall, these are generally the children who end up in the hospital. Hospital's stay can vary. Some children are here with us for 24 hours, some here with us for up to 5 days. Some may be longer depending upon how their course of illness goes. Now, there is also a small percentage of children who need intensive care. Pediatric intensive care because of their dengue and the consequences of the illness. Now that is obviously your remit and you're the expert there. So my patients ask me a question that what different will you do to my child when they are in intensive care rather than in the ward, or what more can you do other than what you're already doing on the ward? Because we know dengue is a viral illness. So what can you do differently?
So as you already mentioned, a lot of the treatment for dengue is what we call a supportive care, because there isn't any specific treatment. There is certain things that you really brought up so nicely is about the high grade fever, and some of these children progress to have what is called a febrile seizure, which is a consequence of the fever that they are having. So in case they have seizures, that would require ICU treatment. The other important thing, there is some 3 important things that we do in the intensive care unit in Manipal Varthur Road that is not possible in the ward. So the first one is, the key word in dengue is that they have what we call as leaky capillaries. And this tends to be a big issue because by textbook itself, this phase of the illness after the fever subsides, we all think the disease has gone away. But unfortunately in dengue, once the fever is gone, is when the capillaries, our blood vessels, become so leaky that the water content in the blood becomes very less. So the blood becomes very thick. So as we can imagine, any fluid that is very thick doesn't flow so well. So when it doesn't flow so well, it can affect blood flow to our organs. So children can have very cold skin, they may not be passing urine so well, they may become very drowsy. So those children we admit in the ICU to monitor how much fluid they require, and we adjust the fluids depending on the thickness of the blood. The second thing that we do in the ICU is, we know that dengue can affect vital organs. And what are they? The heart, the lungs, the liver, the kidney, and sometimes the brain too. So we regularly clinically examine them at regular intervals. Of course, sometimes we do blood tests to see if there is any end organ involvement, we call it, such as the vital organs, are they getting affected? If that is getting affected, we can support them with what we call as a breathing machine. So the breathing machine can be in the form of what we call a non-invasive ventilation or invasive ventilator. Sometimes, rarely, they may require dialysis also, and that facility we can do in our ICU. And towards the end of their critical phase, they develop something called a fluid overload. So the first one was having less fluid, and the second one was about involving the other organs, and the third point is about excess fluid. So it's very interesting condition, this is dengue. So the fluid starts to accumulate in the wrong places. So it may be filling their tummy, it may be filling their chest. So we then adjust the fluids again now, and we may give some medicines for them to pass a lot of urine, which tends to actually sort the situation on its own. And very rarely we may have to put them on dialysis to get rid of the fluid. We may sometimes insert a tube in their stomach or in their chest, but that is on a rare occasion. So these are some of the critical things that we do, apart from monitoring every other, the blood pressure, the heart rate, their pressures in the abdomen, so various other things. But the key important things are the ones I said, the thickness of the blood, organ involvement, and the fluid excess, all related to leaky capillaries.
So, like you clearly said, we have all this here at Manipal Varthur, and we are in a true sense a quaternary center. So I, as a pediatrician, seeing children in OPD, being in the patient-facing part of the hospital, I feel really confident in admitting children, because I know that either they will go home well, or if they do progress, we can do everything here, obviously, with Dr. Guru here, and with our nephrologist, and with our intensivists and cardiologists and gastroenterologists. We do pretty much everything here. Now the other thing, and I'm sure so many parents have asked you this, is about platelets. Every parent comes with the thought that dengue is fever plus low platelets and nothing else. And I'm sure in our experience we've seen, we don't worry so much only about platelets. So tell us a little bit more about that.
So this platelets is one of the blood cells. It's there in the blood. We have white blood cells, red blood cells, and platelets. Now the function of the platelets is to help us clot the blood. So in case somebody has a cut, if they bleed too much, then you think whether the platelets are low. Now the dengue has a way, it reduces the platelets by various different mechanisms which we will not go into. But a lot of the times children tolerate it very well. They don't actually have any signs of bleeding. So if the child is very well or asymptomatic, doesn't have any signs of bleeding, we tend to wait and watch. But we do monitor it, but we don't tend to give platelets from outside, because what is important is for the child to produce their own natural producing capability. unless the child has any blood pressure issues or if the child is actively bleeding, we will not give transfusion. But in case they do require a transfusion, we have an excellent blood bank facility. We can give platelet transfusion. And all of this is a problem for only 24 to 48 hours. After that, slowly the platelets start to improve. Usually by day 7 or day 8, platelets start to improve in the body. So yes, platelets is a concern, but there is few other things that are far more concerning than just the platelets.
Yeah. So whilst we look at platelets, we also look at their BP, we look at their hydration status, we look at effect on other organs.
Yes.
We may not have to do so much to help them recover because as we all know, children have this amazing ability to recover themselves, but we do handhold them and intervene when necessary.
Absolutely.
And I think that's important to understand about dengue, that we don't have to do much. Sometimes it's just monitoring, doing the right things at the right time, and that's important with dengue.
Correct, yeah. The other thing that we always say, and of course you say that too in OPD, is that there is certain groups of children where you or me tend to be little more kind of proactive in admitting them and have a low threshold to admit them. And that group, as we know, is those babies that are less than 12 months old with dengue.
Yeah.
Those children that are that have another medical condition, such as a child with a kidney disease or a nephrotic syndrome or a child with diabetes. Those children, things can go wrong very quickly. So that's why those children, we tend to have a low threshold to admit to the PICU or to the ward and monitor them much more.
Much closer.
Yeah. Absolutely. So the final thing I want to ask you, Dr. Suruchi, is that the question keeps on coming. This is something that happens every year around the same time of the year. So parents do ask us that, is it preventable? Is a question, right?
It's absolutely, and we all know that it's a vector-borne illness. So mosquitoes have to be present for dengue to happen.
Yeah.
And it is this one specific mosquito that loves stagnant water, that loves dirty environment, and it's mostly around in the playgrounds, in the parks, or in our houses, around our plants, generally around the twilight time.
Yeah.
So mosquito prevention should be our priority in this time of the year. So no stagnant water at home. If you're watering the plants, make sure that they drain well. The other thing is the kind of clothes children wear when they go out to the park. So light colored, full sleeves clothes, socks, shoes with laces, then cover them with mosquito repellents. So a lot of children don't tolerate mosquito repellents on their skin. They come out with a rash or they end up with irritation of their skin. So you can use roll-ons or mosquito repellents on their clothes, on their shoes. Smaller babies, you can put it on their prams, on their blankets. So that's a good way of preventing mosquito bites. The other thing is using a mosquito net, especially small babies. If they sleep in a mosquito net, it's much more safer from mosquitoes. Natural methods like citronella plants, lemongrass are also important ways to prevent mosquitoes from entering your house in the first place. And keeping your windows shut around the twilight time so that mosquitoes don't enter. And this specific mosquito, in the apartments we see that there's a lot of this fuming that happens at the twilight time. Now, whilst the mosquitoes move away from the plants, they do come into the lower floor apartment. So they have to make sure that their windows are shut at that time to prevent them from coming in. So mosquito bite prevention is the only way to prevent dengue, and it is totally preventable, to be honest.
Absolutely. So a lot of kind of safety and health protection type of issues. The final question I want to ask you, Dr. Suruchi, that keeps on coming up is, can my child have dengue again, is the question.
Yeah, I think the simple answer is yes. There are many different types of the dengue variety of viruses, and if you get infected by one, there's nothing preventing you to get bitten by a mosquito again and the other variant infecting you. The other thing is the antibodies we develop to the dengue virus are quite short-lived. So over a period of time, we do run out of antibodies and we do get infected over and over again. And the important thing to remember is if a child has had dengue once and they have it the second time, it may actually be much more severe than the first time around. So we are always a little bit more proactive in managing these children. Our radars of looking out for warning signs are always up, and we do inform parents about it too, so that they can watch, because at home they are our eyes for these kids. So yes, dengue can happen over and over again.
Okay. Thank you, Dr. Suruchi. So in summary, what we have discussed is that dengue is a viral infection. Majority of the times can be managed from OPD with supportive measures. a small minority of children do require hospitalization, and that can vary from being in the ward for a few days to requiring ICU. And the pediatric ICU care is mainly supportive, and we at Manipal Varthur have a quaternary pediatric ICU which is equipped with a good team and all the other state-of-the-art facilities. And also it is important that we try to prevent the disease as much as possible than to deal with it. Okay. Thank you very much.
Thank you.